And welcome back. Before the break, we heard from a lawmaker, Libertarian Congressman Thomas Massie, about the House GOP healthcare plan. I like the congressman and respect his opinions, but how? I'm getting so choked up thinking about legislation. How would the GOP plan really affect you, your family, and your wallet, most importantly? Here to break it down, it's Brenberg, Associate Professor of Economics at King's College in New York City. We call it Bryanomics. So we got to pick some winners and losers here with the health care plan in its current form. Yeah. I know Congressman Massie said that he and several of his counterparts were going to vote no, but let's say it passes. Who wins and who loses with this?
So there are some fairly clear winners and losers here. And to put it in a nutshell, the winners are actually people who are healthy and who are wealthy. They're going to get more tax credits under this plan than they're going to get under Obamacare.
That seems counterintuitive, that a socialized medical plan would help the healthy and wealthy. I mean, it seems as though, just from the few books that I've read, maybe really just a few passages, that socialized medicine is supposed to help sickly people who can't afford it.
Well, yeah, I mean, that's sort of the good intention piece of it, but the Republican plan spreads tax credits around more broadly than Obamacare did. So, you know, if you're an older individual with a fairly high income, $100,000, you're going to get much more under a tax credit under the AHCA than you're going to under Obamacare. Contrary, if you're an older individual, 60 to 64, but you have a lower income, $30,000 to $40,000, you're actually going to be 20 to 25% worse off.
I mean, but that is also so cruel because, and believe me, I'm not a bleeding heart. I don't think this is the function of government at all. Yeah. But if you're going to help people, it should be the people who are least capable of getting help for themselves, and people who are poor and sick but who don't qualify for Medicare. It seems like that's a bad group of people to punish.
Now, look, I mean, the Republicans are going to say we have sort of an emergency fund that we're going to grant to states to help to plug some of the hole here. And we also think we're going to get more innovation in the market, which is going to create more competition and drive down costs. But the problem here is you still are giving more money to wealthy individuals. You're still giving more money to healthy individuals. And that's why Congressman Massie, by the way, is looking at this and saying this just isn't going to run long term. People aren't going to be interested in a program that cuts the benefits they have today. Even if there's possibilities for long-term benefit, if it cuts benefits today, people aren't going to like it.
Yeah, no, I mean, he's got to go back to his constituents in Kentucky and say, hey, you know, those of you who are older and a little bit sick, guess what? We're dialing back Medicaid, so you're not going to get help there.
And you can see the Republicans admitting this because in the amendments last night, what they said is we're going to extend more benefits to people age 50 to 64 who aren't getting as many tax credits under AHCA. So they understand it's a problem, and they're putting more subsidies to that because they want to get buy-in from House Republicans and they want to get buy-in from Senate Republicans. But at the end of the day, that's an admission. This is kind of a step one, and this step one means that healthier, wealthier individuals are probably going to get more than they did under Obamacare.
It's really weird when Jim Jordan and Nancy Pelosi start to sound like they're having the same argument. Well, or at least coming from the same place, opposing something where normally there'd be diametric opposition.
Yeah, and look, and the other critique here is it's not a free market plan. I mean, that's what Representative Massie is saying here. It's not a free market plan. It moves slightly in that direction by saying you can use the tax credits to buy any kind of insurance plan, not just one that's approved by the government. But it's really not opening up the market. These phase 2 and 3 changes would probably do that, but nobody really believes they're going to happen because if you really can't get phase 1 done, how are you going to get phase 3 done when you need 60 votes in the Senate?
No, phase 1 is proved to be very problematic just within the Republican Party. And I understand, you know, amending some of the issues and rolling back the regulations through HHS with Tom Price, who knows health care inside and out, and I think that's a positive step. But I agree with you. Phase 3, which is the most critical, is getting the least amount of service. It's getting totally discarded, and that's what would lower cost and improve care.
And that's actually, you talked earlier about trying to roll some of that into the reconciliation bill. I think that's a possibility. Senator Cruz talked about that this weekend. Why don't we try to put more of the regulatory changes into this bill now and see what happens? That's the kind of thing that can get some of the Republicans, some of that conservative Republicans, libertarian Republicans on board.
That's the type of obstruction that I'm resentful of. I think there is a way. I agree with Senator Cruz here. There is a way to get some of the phase 3 into the reconciliation phase. Brenberg, thank you so much.
Good to be here.
Always breaking it down, making everybody smarter. It ain't harder for him. He's so good.